I just wanted to give you a quick video on the OSCE Note-Writing. Just a couple quick tips that might help you. First, I just want to show you what the kind of page is going to look like when you write your post-encounter note. First, you'll see this very top part, which asks you to put down the history that you obtained from the patient. Use only information that's relevant to the patient's problems, pertinent positives and negatives. So here's where you're going to put the HPI, the chief concern, the HPI, the patient's pertinent diagnoses. You're going to put down the history, the HPI, like how did this particular problem unfold chronologically? What are the pertinent positives, the pertinent negatives? You're going to bring in your bold cards. You're going to bring in your review of systems. You'll have more space than this to actually write on it, but this is just a representation of what you'll be able to do. You want to also write down other things like past medical history, medications, allergies, social history, surgical history, etc. I'm going to go through that in a second. Basically, all of the history that you would normally do, except in an abbreviated form that is pertinent to the patient's problem that they're presenting with now. Here's the physical exam. You want to put the vitals. Do not forget to put the vitals there, and then also put down the other pertinent physical exam that you did. Okay, so write down the physical exam that you obtained for that patient there. And then you have these three areas, okay, where you have diagnosis 1, 2, and 3. And these are put in order of likelihood. So diagnosis 1, the most likely diagnosis that explains the patient's primary problem. Then diagnosis 2, the second most likely. And if you need to, you don't always have to put a third diagnosis, but most of the time you will. Number 3, a third diagnosis that might explain the patient's problem. And then you put down the history findings that are positive, not pertinent negatives here, but only pertinent positives. What history supports this diagnosis? What physical exam finding, anywhere from the vital signs to any part of the physical that you did that was positive, which physical exam findings support this diagnosis being at number 1. And then you do the same thing for diagnosis 2 and 3. Put down the supporting history, supporting physical. Down here at the bottom, you want to put down any diagnostic studies that you might want to obtain for the patient. And this is going to be like check a hemoglobin level, check a white blood cell count with the differential, check a creatinine, check AST, ALT, whatever it is you want to obtain for the patient. You can also include imaging, check, spine films, check a chest x-ray, check an abdominal CT, whatever you think it is. This is also an opportunity to put in information regarding any sensitive exams you might want to do. Patient needs a pelvic exam, breast exam, things like that. Couple quick points about what we just went over. Make sure to include in the history section, chief complaint, the HPI, including relevant review of systems, past medical and surgical history, family history, social history, meds and allergies, and then key physical exam findings, including the vital signs. The diagnostic reasoning part, as I mentioned, the top 3 diagnoses in order of likelihood with supporting evidence from the history and physical exam. Testing, labs, studies, sensitive exams. Don't put down treatments or consultations or referrals, only the tests you want to do and any sensitive exams you want to do. Make sure to use technical terms, not lay terms. And here's some examples of sensitive exams that you might want to order on patients. Use medical terms in the note, not in the actual history and physical when you're actually engaging with the patient, but when you write your note, use medical terms. Detailed documentation in the history and physical is really important. So things like pharynx is without exudate or erythema is appropriate. Pharynx normal does not help you. That is too vague and nonspecific to be a high-quality physical exam documentation. Only list diagnoses that can be supported by the history or physical. And as I mentioned, list the diagnoses in order of likelihood. Here's an example of what you might see at the doorway. Patient's name, age, chief concern or complaint. You might have the vitals listed for you. And then you're going to also have learner task. It'll tell you what you have to do. Please pay attention to what these tasks are, because sometimes you might get to an OSCE and the task is going to be counsel the patient on cigarette smoking. Okay, the task is not going to be do a detailed H&P and try to find out what's causing the patient's cough. It might be the task for this session is counseling. For the sessions you're going to do on the mid-semester OSCE, it's going to be something like this: focused history, pertinent physical, clinical impression, workup. Okay. This says 10 minutes to document your findings, and that's consistent with what you guys are going to have too. Before you go into the room, think about your differential diagnosis. Think about questions you might need to ask. What organ systems are being affected? That's really helpful. This is an example of the note page once again. So pretty straightforward. I think you guys are going to have a great time. You'll do a great job with it. And remember, this is practice for you. These skills are going to continue to improve as you further in your career. So that's it for this. Good luck, have fun, and be in touch if you have questions. Bye-bye.